Assalamu alaikum and good evening all of you. Before starting anything, I would like to share a famous spiritual quote which I always use to amplify my abilities. It goes like Imam Ali Raza quote from his father Imam Musa Qasim. He quote from his father Imam Jafar Sadiq. He quote from his father Imam Muhammad Baqir. He quote from his father Imam Zainul Abidin. He quote from his father Imam Hussain. He quote from his father Maula Ali. He quote from the Holy Prophet Muhammad sallallahu alaihi wasallam. And he said, what faith is? Faith is knowing from your heart, expressing it through your tongue, and performing it with your organs. So whatever you do in life, faith is the basic necessity for everything. In this session, we will discuss the management of arrhythmias. But first of all, we will discuss what arrhythmias are, and before discussing the arrhythmias, it is important to understand the cardiac electrophysiology, that is the conduction system of the heart, that is the myocardial tissues. So, the cardiac electrophysiology is divided into four portions or four schemes, that are impulse generation, conduction, excitability, and refractory period. Starting with the impulse generation, that how an impulse is generated in a cardiac myocyte. For instance, there are two myocardial fibers. One are classified as non-automatic and the other are classified as automatic. This is a schematic representation of a non-automatic and an automatic fiber through which an impulse is generated. The one in the blue is the non-automatic impulse generation, and in red is the automatic impulse generation. So starting with the non-automatic impulse generation. In the non-automatic impulse generation, the impulse is ordinary and is not capable of generating itself. As you know that the pacemaker, which is sinoatrial node, and the AV node and the Purkinje His system are capable of producing their own impulses. But except these systems, the remaining of the heart cannot generate its own impulse. So except those systems, that is the sinoatrial node, the AV node, and the Purkinje His system, all of the cardiac remaining system tissues are of the non-automatic fibers and develop an impulse generation due to a non-automatic impulse generation. So in non-automatic impulse generation, the depolarization is spontaneous and maintenance. That is, the phase 0 appears in a maintained way and is maintained up to the phase 1, that is the highest peak of the membrane potential of the fiber. And as a result of depolarization, there is often a shooting up mechanism, as a result of which the membrane depolarization often reaches up to plus 30 millivolt. After achieving the phase 1, the phase 2, that is the plateau phase, is obtained and is maintained slowly. The overall generation of the depolarization is quick and fast, and followed by a rapid maintenance, that is the phase 2, and followed by a slow repolarization, which is the third phase of an impulse generation. And after the end of the repolarization, that is the after repolarization, the fourth phase, which is known as after repolarization phase is stable and does not decay. However, the automatic fibers are present in the SA node, the AV node and the Purkinje His system and are capable of developing their own impulse spontaneously. So comparing an automatic impulse generation with the non-automatic impulse generation, the generation of impulse is most rapid and fast but does not overshoot after achieving its highest membrane potential, which is always below than the plus 30, that is the maximum value, and followed by the plateau phase, which is also rapid, and further the repolarization and the after repolarization. But however, in the after repolarization, the fourth phase is not stable and decays spontaneously to develop a new impulse. But as observed in the non-automatic one, the fourth phase was stable until the generation of another impulse. But here you can see that in the automatic fibers, the phase 4 is not stable and decays immediately after reaching it to generate a new impulse spontaneously, and the remaining next generations are followed respectively the same as observed here. So this was the impulse generation and classifying it into the non-automatic and the automatic fiber systems induced generations. So proceeding with the second phase of the cardiac electrophysiology, which is the conduction. The conduction is the receiving and transferring of a generated impulse between the cardiac myocytes. The conduction is also referred as membrane responsiveness, which means the rate of conduction within the cardiac myocyte. Now this is a representation of a conduction system that is followed in the cardiac myocytes. Here on the x-axis is the transmembrane potential in millivolts, and on the y-axis there is the rate of depolarization in the space 0, which is in the unit of volt per second, that is the conduction velocity per second. So this is a typical and a normal conduction behavior which results as a function of rate of depolarization of the phase 0 as a function of transmembrane potential, and it is developed in such a way that increasing the transmembrane potential towards the resting membrane potential, the depolarization initiates and is maintained after conducting and perceiving the impulse within the cardiac myocyte. The next phase is the excitability, which is referred to in terms of strength of stimulus, that is to perceive or develop a response or an action potential. So the excitability depends upon the strength of the stimulus that will develop an action potential within the cardiac myocytes. As a result of hyperpolarization, the stimulus, or you can say the excitability, is less as a result of hyperpolarization, but in the terms of small changes in the resting membrane potential, the excitability of the cardiac myocytes increases, which is prone towards the conduction system. But as a result of sudden or spontaneous hyperpolarization of the cardiac myocytes, the excitability is reduced. The next phase is the refractory period, which is often referred as effective refractory period, which is considered as a minimum time interval between two action potentials that are generated in the cardiac myocyte. Consider this as an action potential in which four phases are present, which are the depolarization, the achievement of the maximum depolarization, which is phase 1, maintenance, and moving towards the repolarization, which is referred as the plateau or the second phase, and followed by the repolarization, which is the third phase, in which the transmembrane potential forwards towards the resting membrane potential again, and after reaching the resting membrane potential again, a maintenance period is present, which is the fourth phase. So starting from the fourth phase is considered as an effective refractory period, which is present between two action potentials or two impulse generations. This is the effective refractory period. This is considered as an impulse, and this will be another impulse. So the minimum time interval between two impulses or two action potentials is considered as effective refractory period. Now we will look into the arrhythmias and the mechanisms through which the arrhythmias develop and propagate in the cardiac myocytes.